Back there? Microphone? It's on. There we go. All right. Can you hear me now? Yeah. All right. I can't see you. The lights are so bright, so just letting you know. So I want to thank you all for coming tonight and actually coming today because this is a great turnout on a rainy day in New York. So I'm really proud of all the people showing up today. And I also want to thank Stephen Shore and the Real Truth About Health Conference and the sponsors and all the volunteers for making this happen. And I'd also highlight and recommend you purchasing the highlight package because I'm going to talk very fast. That's what I do. People tell me I need to slow down, but they're going to take transcript notes, so if you buy the package, you can get the full book from what I'm going to talk about today. My name is Dr. Pai. I wrote a critically acclaimed book called An Inflammation Nation. It's what I consider the 10-step definitive guide of preventing, reversing, and treating all disease. And I want to talk about a little bit about my background today. I'm going to talk about what is inflammation, some of the problems with our healthcare system of why we have a lot of this inflammation, some of the problems of our food industry of why we have the inflammation as well. Don't mean to be political, but sometimes I will get political because we're in a political state of mind right now. And I want to then give a little bit aspects of what can we do in addition to the diet in terms of when we interview a patient from an integrated perspective of how to look for even food sensitivities, how do we look at nutrient levels, how do we look at your microbiome, how do we strengthen your immune system, and how do we lower inflammation using natural therapies. And if I have time, I'll try to cover some of the other steps in my book. So my journey begins actually at the age of 2, when I had my first near-death experience. And I've had many since, and that started when I was age of 2. My parents, coming home from a long day of work, they stopped by their local farm, and my dad picked up a bag of peanuts, and as we're in the kitchen, my mom was cooking some dinner, my dad was sitting on the table, put me on the table, and he was shelling some peanuts, and everybody was eating the peanuts after work. Within a few minutes, they started noticing that my eyes started to swell up, and it became the size of oranges, and my lips started turning a little light blue type color, my throat started to close up, and I basically fell over. And my dad, luckily being a great physician as he is, he took me immediately to the emergency room, and thankfully I lived in a small town, so the hospital wasn't that far away. They took me to the emergency room, and they gave me epinephrine, they gave me steroids, they put me on a ventilator, intubated, and that was able to save my life. I had a severe anaphylactic reaction to a food. At the same time, though, so Western medicine saves my life, at the same time, at the age of 2, I started to develop this chronic eczema. And it was a very bad eczema, so bad it almost looked like psoriasis. I got these really bad plaques all over my body and neck and arms, and that plagued me throughout my life. In fact, it started in not only since the age of 2, but when I started to play soccer in my elementary school, I'd wear long sleeve shirts and long socks. That plagued me all the way through high school, all the way through college, all the way through medical school, all the way to residency, and even fellowship program. Okay? And then in 2009, as a late bloomer as I would say, turning into the plant-based diet and plant-based world, I read the book, The China Study, which Dr. Colin Campbell will be here later this week, which I recommend everybody to attend. And he's been a big influence because his book had the definitive study of looking at kind of diet and lifestyle interventions on a large population. And that data was so impressive to me, because I'm an evidence-based person. You'll know if you read my book, 400 pages with 1,500 references of scientific studies and investigative journalism. I like data, and so I actually took the effort to take the course at Cornell before it was even a CME course. I said, I just want to learn more about it. So me and my partner, Maureen and I, we took the course, and after we read the book, and then we finished the course of looking at all the 8,000 data points of why, diet and how diet affects health, we said, let's go plant-based. So interesting enough, within 2 weeks of going on a whole food plant-based diet, my eczema disappeared. Completely, okay? Now, this was shocking because, throughout my training, when I finished my fellowship in 2002, and, Stephen mentioned all my backgrounds of all the different various treatments and modalities that I've studied, and I've traveled across to India and other countries and had world training with experts in herbalism medicine and Ayurvedic medicine and Chinese medicine and acupuncture and homeopathy. Everything that I would use for my eczema, from a conventional standpoint, from dermatologists, allergists, immunologists, was just symptomatic treatment, right? Here's the salve, or here's a steroid, or here's an immunosuppressive drug, or antihistamine, and it would help partly for a while, but as long as I stopped taking the product, I would still flare, okay? And they had many side effects that I was trying to avoid as well. Same thing with the natural products. I would take an herb, I would take a homeopathic, I would, a salve or a potion, as we call it, or a lotion, as you want to call it, and that would calm the eczema down. But if I stopped using it, I would flare again. So within 2 weeks of a plant-based diet, it went away. So this led me to understand, like, well, there's something there that's in the diet that's triggering eczema. We know eczema is an inflammatory response. But it wasn't so important that it was something miraculous to me, is that we missed the concept in Western medicine of my acute care was wonderfully perfect, and I still carry an EpiPen, and we still like people to go to the hospital for acute care. But this led me to look at, well, what has it affected to not only me, but also my patients' chronic conditions? Because everybody has chronic inflammatory responses. So in this review of, like, well, what is causing this, this led me to take this journey. And this is what led me to write the book and let me develop a product, actually, that was supportive, is that I had to go further, right? Because why are we here? Why did the system actually miss my eczema? And why was I actually being exposed to something that could actually trigger that in my diet? And so this led me to go discover, inconveniently sometimes, of investigating, follow the money. I'm the kind of guy I follow. I'm really kind of a medical investigative kind of person. So it's not just science, it's like, why are we here, and what's going on to keep us here? And so with that in mind, we came to this. My opinion is that right now, healthcare is under assault. Insurance companies, for example, are not in the business for our health. They're in there for profits, right? Wall Street profits, stock market profits, CEOs and high administrative salary profits, medical companies, supply companies, pharmaceutical companies, even going into the food companies, right? This is all what's keeping us unhealthy. And I'll just give you an example. People say, well, gosh, shouldn't we have some kind of universal health care? Yeah, we should. I'm going to talk a little bit of politics because we can afford it. Because right now, we can't afford just our health care. Let me give you an example. If any of you have been to the hospital just for a simple pneumonia for 3 days, that's $10,000. If you have a fracture, it's about $15,000. If you have low back pain with a little disc problem, it's $18,000. If you have a little chest pain with a little bit of cardiac, maybe possible myocardial infarction or heart attack, that's $20,000. If you have even a heart valve problem, that goes up to $42,000. I haven't even talked about a gunshot wound or unfortunate car accident happening. Now, if you have cancer, the cancer early stage diagnosis up to stage 3 can be anywhere from $100,000 to $300,000. And then when we get to up to stage 4, at end stage, it can be up to $1.4 million. Okay? Now, here's the problem. Everybody has an insurance policy that we pay a premium. The average person is spending about $400 to $800 to $1,200 a month as their premium. Then they have a deductible. The deductible is how much you pay before your insurance kicks in. So the average deductible now is anywhere from $4,000 to $8,500 per person. So you have to pay your deductible, you're paying your monthly premiums, before your insurance kicks in. But here's even further the kicker, is that they have something called co-insurance. So in your policy, you'll say that there's roughly a 30 to 50% co-insurance. That means you owe 30 to 50% of your hospital stay. Okay? Now, again, the number's 100,000 up to 1.4 million. That means you will owe 30% to 50% of whatever the hospital charges because there's no control of healthcare. So we cannot afford the way healthcare is going right now. And then you have to pay copays, believe it or not, right? So you have to then pay a copay when you see your doctor. You have to copay when you get your medications. You have to pay a copay with your laboratory fees and your x-rays. So the way we're looking at healthcare is not affordable. And we actually have to be looking at something, I don't want to be political, but universal healthcare is not a radical idea. If you look at all these countries here on the map, right, these are countries that we travel to on vacation. These are our trading partners. These are our allies. They all have universal coverage. Right now with my insurance company, I cannot get sick in New York because I don't get coverage. And in fact, I can't even leave Albuquerque because my insurance policy won't even cover me outside of my state. And it even limits me to, for example, 1 hospital out of the 3 hospitals, and it's the furthest one away from where I live. So I like to tell people, we have to start thinking a little bit of why we're stuck in this area because companies like to make money. Now, if you think, well, we're still the #1 country in the world and we have the best healthcare, that's absolutely wrong. Okay, so I'm here to open up your eyes. In fact, when I sit with my patients, I use this analogy a lot. It's for those of you who've ever watched the movie The Matrix, hopefully you've watched it before, old-fashioned movie. So there's a scene with Morpheus, and he's sitting there with Neo, who's Keanu Reeves, and it's the red pill, blue pill discussion, right? He gives him this opportunity. You can take the blue pill, and you can kind of go back to this world of ignorance, or you can take the red pill, and although it's uncomfortable to understand what's happening, you will actually understand and gain consciousness. With consciousness, that'll open your mind to open up to make better decisions, and hopefully that'll liberate you from the kind of these shackles that we're kept in. And so today, what we're looking at is opening the consciousness so you understand that you're not here by default. Your disease is not by default of you making bad decisions, but predominantly it's by design. We've kept you there. Systems marketing companies have kept you where you're at, and they're keeping you where you're at. So what did this money give us? $3.8 trillion. That's with a T. $3.8 trillion is what we spent on healthcare, 17.9% of our GDP. And in fact, right now, it's projected to go up to 20% of our GDP in 2 years. Okay? $370 billion on drugs was spent. Now, with all this money, what did that get us? We are now ranked 16 at the bottom of the 16, top 16 with the bottom here, from death from all causes. So we die more from infant mortality, homicides, teen pregnancy, HIV, AIDS, drug-related deaths, obesity, diabetes, heart disease, chronic lung disease, and disability more than 16 other countries. Remember, we spent the most. We spent more than any other country combined here. We're now ranking 34 out of 35 countries in terms of life expectancy. So it didn't buy us more life. A lot of people say, well, we pay for all this health care. Shouldn't we be living longer as Americans? No, in fact, this is old data because if you listened to the news 2 weeks ago, the report came out that we fell even further. And then when we look at ranking overall, in terms of diseases A through Z, so from top of your head to the bottom of your head, and all diseases, where do we rank in the world? We're now ranking 46 out of 48 industrial nations in terms of chronic disease care. 46. So if right now, if I go to Congress right now, if I go to any kind of politician, or if I even go to somebody on the street, we're number one, we're Americans, yeah, we should be at least in the top 3 of everything. We used to be, but we're now 46 out of 48 industrial nations. And if you look at, well, who's 43, 44, or 45? We have Dominican Republic, we have Turkey, and we have Iran. So before we start throwing stones at other people and having political problems, maybe we should start fixing things at home. So I want to start off with saying what we have become through all this aspect of politics and food is we've become an inflammation nation. Right? We're not only inflamed physically, we're inflamed emotionally, we're inflamed spiritually, we're inflamed environmentally now. Right? We have fires all over the planet. So we have to look at how do we control the inflammation. And today I'm going to talk about the inflammation in your body. So inflammation is the triggering mechanism of all disease. Okay? It's not the cause of disease, it's just that every disease has an inflammatory component. And from A to Z, from Alzheimer's to cancer to diabetes to autoimmune or neurological disease, there's always an inflammatory component of that. And so think of inflammation as the fire within your body. It's a simple way to think about it. And actually, inflammation just means, and it comes from the root word, flam, fire, okay, inflammation. And the word basically means itis, I-T-I-S. And anything that we put in front of that itis just means inflammation of that area. Now, not all inflammation is bad. We do need some inflammation. For example, we have acute inflammation. So if you have a fever, you're traveling here, coming outside in the rain, have a little cold or flu, you get a little bit of a fever. That's a good thing. Your body's evoking an immune response to upregulate its temperature so the body can actually fight, fix, and repair itself against a virus or a bacteria. And even in cancer patients, they spike fevers because the body's trying to heal and fight. When you sprain your ankle, for example, that ankle gets swollen. Why does it get swelling? Because the body wants to say, hey, there's an injury here. I need to make a natural cast so that the body doesn't move it, so it'll be stabilized, so the healing can occur. So in an acute response, inflammation is pretty good. But when the inflammation becomes chronic, it becomes a problem. So think of, I have a picture here of your kitchen, your living room, and a bedroom. We need to keep the temperature pretty good. We need a little bit of fire to keep it warm, to cook our food. But when it's an uncontrolled type of inflammation, and we all know, especially if you use a gas fire, how quick in a kitchen that can happen, things can get out of control. So the biggest problem is now with chronic inflammation is chronic inflammation leads to chronic diseases. So you can see here, there's a picture here, there's a knee. If you have a knee, you have chronic inflammation, we call it arthritis. You have a colon, you have chronic inflammation, we call it colitis. On the upper part of that picture, we have vessels. This is your heart. And heart disease, which I'll talk about in a minute. Heart disease is a double whammy. It's that we're eating pro-inflammatory foods which are animal proteins. People will always ask me, what is an animal protein? My answer is anything with a mother or face. Just simple as that, right? So eat less mothers and faces. That's as Simple way to remember what an animal protein is. But it's not just the animal protein itself that has the cholesterol that's the problem. It's the pro-inflammatory aspects of that animal protein that makes that cholesterol stick, that ends up having cardiovascular disease and heart attacks and strokes, etc. And then in the bottom there you see the brain, so brain inflammation over time, and now this is going to be one of the biggest factors in the next 15 years that will actually potentially sink the economy in terms of healthcare, is dementia, right? Parkinson's disease, Alzheimer's disease. All this chronic inflammation in the brain creates neurodegenerative changes, and there's a couple of lectures here already given that people were talking about brain health. Now, here's where we're going wrong, and this is how we're going to solve this problem. We have over 200 different itises. So let me start from here. So if I have like some itchy scalp and I go to my dermatologist, they go, oh, you got some dermatitis. And I have some red eyes, I have some conjunctivitis, and I have a runny nose, I get rhinitis, and I have a stuffy nose, stuffy sinus cavity, and I have some pain, a little bit of fever, I get sinusitis. And then I go to my dentist, and I have bleeding gums, and I get gingivitis. And then I have a thyroid problem called Hashimoto's thyroiditis. And then I have a little bit, right now, I have a little bit of laryngitis because I've been talking all day, giving interviews. Some people get a sore throat, but they get pharyngitis. You can have reflux and stomach problems, like GERD, they call it, or reflux, and stomach pain. That's esophagitis and gastritis. Again, I mentioned colitis before. Men can get prostatitis, women can get vaginitis, we all can get arthritis, tendonitis. I mean, the list goes on and on. Now, everybody here in this audience, I can guarantee that we've had some of these itises sometime in our lifetime. Some of us have more than others. And the problem is then we treat it by micromanagement by each specialty in medicine, right? So here's my shampoo for my derm, here's my eye drops, here's my nasal spray, here's my inhaler for my lungs for my bronchitis, I forgot that one. Here's my upper pill, here's my lower pill, and here's my topicals, right? So everybody's treating the inflammation at the level that they see it, but no one ever asks the simple question, what is triggering all this inflammation? And where is it coming from? So that's where we have to go further. It's not just treating inflammation, it's looking at what is the cause of the problem. Now, inflammation over time can then trigger not only chronic disease, but it moves into a serious issue of that you can increase your risk for cancer. So those patients that have colitis, inflammation of the colon, 43% over 30 years will develop colon cancer. That chronic inflammation causes degenerative changes. They also can trigger more growths of polyps, and those polyps eventually, more often than not, can turn into cancer over time. Same thing when we're looking at active rheumatoid arthritis. These are just a couple of examples. So someone has active rheumatoid arthritis over 10 years has a 71-time higher rate of getting lymphoma, which is a cancer. Right? I saw 2 patients last year who had rheumatoid arthritis between 12 and 15 years, not managed or resolved, and had lymphoma. We have to look at resolution of disease. So from an integrative perspective, we don't manage disease, we resolve disease. That's the whole intention of medicine. It's supposed to be resolving disease. The problem is the system has been designed to manage your disease, to keep your disease going. So, you have diabetes, you have heart disease, you have blood pressure problems, and forever you have this condition, and as long as we're managing it with medications, management is not resolution. Okay, so we need to be moving towards resolution. Now, the good news is that chronic disease and cancer is predominantly preventable, 97%. So let me tell you this. Diet now is looked at as the largest contributing factor for chronic disease and cancer. Okay, it's about 35–40%. Smoking, which none of you hopefully smoke, or vaping now, hopefully none of you vape, those are also the second most common cause of chronic disease and cancer. Then obesity is number 3, so keeping your body mass index normal. Now, we've grown over time. We've supersized. It's not just the drinks. We as Americans have supersized ourselves, right? You can just go to Texas, for example, and see that. Southern half of my state, even the northern half of my state, obesity is now running rampant. Even morbid obesity is actually growing now in the United States. Infections. Infections mean that when we get sick due to our immune system being low, then we actually trigger inflammatory responses. So certain types of viruses, chronic virus conditions, can increase higher risks of certain type of cancers as well, like, say, cervical cancer and stuff like that. And then environmental pollution and radiation and other things. So some people are talking about, like, 5G, and we're looking at organics and trying to avoid the herbicides and pesticides and endocrine disruptors. So these are important things because these are all aspects. And then genetics. Genetics is, this is an old research model. The authors actually came back and redid that. It was actually 5–10% at the time in 2009. Now it's looked at as 2–3%. So disease that's genetically related is only 2–3%. But people will say, well, Dr. Pai, heart disease runs in my family. My grandfather had a heart attack. My dad had a heart attack. My brother had a heart attack. And heart disease is like the gene that I have. Genes aren't fixed that we used to think. Genes are in flux. Okay, it's called epigenetics. It's the diet, the lifestyle, the environment, and belief system that it turns on or off the expressions of genes. We all have been dealt the same cards. It's how do you play the game? And what this does with epigenetics, this is why we see things run in family, because it's the same diet and lifestyle. Right? So it's something that grandparents pass down to parents, parents pass down to their children. Sometimes no fault of anybody. That's just what we knew. That's what we were told. That's what we were taught. But the nice thing is that we should be focusing on the 97% of disease and things that you can do daily that you can take advantage to control your health. Now, where does inflammation like to go? So inflammation likes to go to 4 places. I like to use a lot of analogies in my book. My book is full of analogies. I talk about analogies all the time because I want to take complex ideas and make them very simple. So in New Mexico, where I'm from, in Albuquerque, we have these wonderful southwestern homes, and they're flat roofs. So I always tell my patient, your body's a flat roof, and the rain is inflammation, okay? And these flat roofs, they don't drain well. So when we think of trauma, trauma is injury. So if you've had an injury, it could be yesterday, could have been 50 years ago. Maybe you played football in college, maybe you got a car accident 20 years ago. Doesn't matter what that accident or injury is, once that tissue is damaged, on a microcellular level, there's still a little bit of inflammation there. It's like a kitchen pilot light on your stove. It stays on, but it's not hot. But if there's any pro-inflammatory fuel that comes in, that kitchen pilot light will light onto a fire again. So when someone has a knee and they injured it 20, 30, 40, 50, 60, 70 years ago in an accident or injury, for example, and then now they come to my office and go, oh, what's wrong? Oh, I have arthritis in my knees. What? Oh, I had a college football injury. When was that? 50 years ago, okay? So why does it hurt now? Well, I have arthritis. Well, why do you have arthritis? Well, because I'm old. I'm getting older. It's a disease of aging. I go, no, arthritis is not a disease of aging. It's inflammation to the knee joint over time of some pro-inflammatory trigger that keeps lighting up that spot. So we have to look at all these conditions are not, they're lifestyle induced. They have initial trauma. But the idea is that once there's a trauma, if it rains, that place is more likely to have the inflammation go there. Pathology means disease, so if someone already has a disease process, for example, like a tumor or a lump or a bump or degeneration, that's like the tree falling on your roof. The rain is going to immediately go there. Third place is overuse. Overuse is thinking of like, repetitive motion. So people that work at the checkout or people are working construction or someone who's even typing, the transcript person who's going to record this lecture, they're going to have some inflammation of their wrists, okay, typing all these words. But overuse triggers inflammation. Now, exercise is good. We need exercise. And for those people who haven't watched The Game Changers, that's a movie I'd recommend, The Game Changers. But why professional athletes are moving towards a plant-based diet? Because it's all about inflammation. Right? When you work out and you exercise, you induce an inflammatory response, and that's why you're a little bit sore when you exercise. That's a good thing. You're actually building muscle. You're building, kind of the strength of the body. However, too much pro-inflammatory foods that most people eat make them sore, and then the sore is inhibiting their recovery, and the recovery then inhibits them how long they can train. So when people move plant-based, for example, then they recover faster because they're less inflamed, and then they train more, then therefore they're a better athlete. So overuse is one place. And then places where your immune system's not paying attention. So that's when we look at the importance of the immune system, looking at vitamin D levels, looking at natural killer cell functioning, and this is the certain things that we can see with inflammation. There are 7 or more categories here. In my book, I go through each one in detail, but I'm going to stick to the middle one today, which is the standard American diet. Okay? Smoking, solar radiation, alcohol, infections, environmental pollution, and stress. Stress is a big one. If I have time, I'll talk about that, but let's start off with the diet. Now, I have 10 steps in my book. These are the steps that after 20 years of practice integratively that we've looked at what can we give our patients that will affect their epigenetics. So this is evidence-based. So if people do what we say in the book, 80%, I can say that off the hand because this is what we get, 80% of every condition will get better. Why is it not 100%, Dr. Pai, people will ask me? It's because now we have to look at individualizing. And I'll talk about how do we individualize the diet, how do we individualize nutrients, how do we individualize everybody's microbiome and system of functioning. So let's look at what are we eating in the standard American diet right now. So the average American eats per day, this is per day, 1 pound of animal protein, beef, chicken, eggs, pork, or fish. 1 pound. 2 pounds of cheese and dairy products a day. Half a pound of refined flour. All you can eat breadsticks, foot-long Subway sandwiches, a pound of vegetables, but that's in the form of French fries. And here's the interesting thing, the government now, because it's such a big thing now in some of the guidelines now, ketchup is now the second most consumed vegetable now in the diet. And then consuming about 18 ounces of soda a day per person, a third of a pound of GMO sugar and high fructose corn syrup, sweeteners, and an ounce of artificial sweeteners like the pink and blue and yellow packets. My book will go into the detail of each of these things and why there are problems. Now, this has led to this increase of inflammation, so let me explain. In 1950 to 1960, we all know that omega-3s, everybody hears about omega-3s, we've been talking about it on the panel, you'll hear it all week. Omega-3s, right? Flax, chia, hemp, walnuts, some of the seeds. Some people take fish, which we're not recommending. But these are all the omega-3s, right, that help with lowering inflammation. These are omega fatty acids. These have an anti-inflammatory effect, a cardiovascular protective effect, helps with the joints, and the DHA helps the brain. Now, in 1950, 1960, there was a ratio which was about 1-to-1, depending on the literature, or 2-to-1, depending on the literature that you read. 2-to-1 means that we ate the animal protein, but we ate it rarely, okay? It was like Sunday. It was after church. Dad got a raise, grandma came over. It was a holiday, it was a celebration. So we feasted, we had a roast, we had a steak, we had, all this kind of food, but then the rest of the week we famined. Why? Because it was expensive. We couldn't eat this every day. Right? But what happens is as food production goes up and products of food goes down in terms of price, the average person by 2012 was eating about 40 times more omega-6s to 1 omega-3 in their diet. And in some parts of the worst part of the country, which we call the stroke belt, there's actually a map that's called the stroke belt, they actually have a 70-to-1 ratio. So they even fry the green tomatoes in those areas. Now, why did we get there? Because food is so cheap. Food is cheaper than it's ever been in the entire history of the planet, right? Dollar menu, jumbo deals, boxes. In my state, we're the 40th poorest state in the country, unfortunately. So when people say, oh, the economy's doing good, no, it's not, is that unemployment is not doing better, it's that more people are working 2 to 3 jobs, right? So when a family of 4 in my state makes about $40,000 on average, a bucket of chicken for $20 with sides goes a long way. But what happens is by pushing people to eat cheaper foods due to this economy that we have and other constraints of what's happening here, this is this vicious cycle where we're now stuck eating more pro-inflammatory foods more than we ever did. In fact, when I was a kid, when my family used to take us, we actually used to go get a bucket of chicken. It was on 4th of July. It was the Super Bowl. It was expensive when I was a kid, but now it's super cheap. And so people go and eat these foods every day because every day is game day in America. There's a game every day on some channel. So this kind of drives us. Circular aspect. Now, the other thing is that, to hopefully get you a little bit more into political activism, is that 11 of the top insurance companies, and my book goes through all sorts of politics of food and food industry and health industries, how they're kind of in bed with each other, but 11 of the top insurance companies own about $2 billion of stock in the top 5 fast food companies. Right? So that should make you angry, because that means they're having you buy cheap food that makes you sick, that makes you then have to pay more of a premium and more of a copay and more deductible, and now you have a pre-existing condition, which now they charge you more of these. Right? So there's no health in healthcare anymore. We have to be looking at how can we look at changing the system. Now, my book will explain in detail, I won't go into too much detail, but how come food is so cheap? So I go through each of the steps of each food industry, because you'll be surprised. And, I'll be frank, before I became plant-based, I was vegetarian predominantly. And then I became one of those clean food eaters, Oh, my fish came wild-caught from Alaska, and my beef was, massaged by Japanese massage therapists, right? My eggs were from Taos, and Taos eggs are free range, and they sit by the fire and they play kumbaya, and this is what we're sold, and all of this is like bad information, by the way. Okay, so my book will cover like pork right now, how the majority of pork in the United States, and now starting recently chicken, is grown here, shipped 7,000 miles to China, processed in China, shipped 7,000 miles back, and it's cheaper than it's ever been, ever. Now, you don't have to be an economist to figure out something is odd with that equation. The book will go and explain why. Farm-raised versus wild-caught. So we all think, oh, wild-caught, wild-caught, wild-caught. My book will explain how we can take now farm-raised fish, they're grown in tanks with antibiotics and pesticides, herbicides, and other animal parts and human parts and stuff like that. It's terrible. And, the flesh of the animal is like this darkish, grayish color. And now what they do, they can add a carotenoid that comes from shrimp shells, astaxanthin. You hear that the other day with Gabriel Cousins was talking about how we use that. Well, the industry uses these off shells of the shrimp, and they actually can put it as a natural dye into the tank, and it turns this brown flesh into pink. Okay? Then what they do is there's a machine that's at the side of this river that they're at, and it drops the fish, and it picks them up about 20 feet later, and now it's considered wild caught. This is what it is. And I would just be like, oh, it's wild caught, yeah. The marketing on the internet was really good. Even GMO fish. So the GMO salmon was introduced, right? And they blocked the labeling law, so now you can go get a wild-caught GMO salmon, which is, as you can see on the picture here, how big it is. We don't have any long-term studies on the genetic modification of an animal species that have been consumed by humans or what it's going to do to the environment when that has the effect itself on the environmental aspects. In my book, we'll cover things like meat glue. Right? So how do we get steak so cheap? When I was a kid, again, I used to go to a restaurant, and it'd be something very expensive. I'd look over the side, and we'd see someone eating a steak, and they were dressed really nice. And I'm like, wow, we used to look like, wow, they must be, they're higher class. They were able to eat this, or they would go Ruth Chris Steakhouse and stuff like this. But now when you go to the steakhouses, you can get all-you-can-eat steak and shrimp for $7.99. How is that possible? Because we use things like meat glue. We get all the scraps of any of the meat products. We put this, it's an enzyme that comes from pig's blood and cow blood. We sprinkle as a powder, we wrap it in cellophane, and then we refrigerate it 6 hours later. It becomes a nice log, and we chop it up in steaks and serve it. Same thing with chicken thighs, and same thing with pork products, okay? I won't cover the chicken today, I won't cover the beef, there's a lot of things, but even what we have here is modified atmospheric packaging. It's how they can take red meats now, like beef, ground beef, and then we actually put it in the cellophane packaging of using carbon dioxide or monoxide, which makes the blood of the tissue there more pink and red. So that's what we think of fresh. But it can keep the food after it's spoiled up to 2 weeks. Now the studies show up to 2 years. Right? So how many people are like, oh, I take this, I cook this, I got sick, I got diarrhea, I eat the same thing. Well, what is it, And people not eating it raw, they're cooking it, right? So here's another example, and then we'll get on. But 5 billion burgers consumed, and people are like, oh, I need my all-beef patty, Dr. Pai. All-beef patty. I used to be like the same thing, again, massage therapy. And the studies showed through the Annals of Diagnostic Pathology, this is a forensics journal, medical journal, that they took and analyzed the meat content in the top 8 fast food chains, and they found it basically had between 2 and 14%. That means 85% to 98% of your all-beef patty is not meat. Shocking, right? So what that means, if you had 2 quarter-pounder cheeseburgers, that's 5 grams of meat protein, which is 5 paper clips worth. Right? So you have to really start thinking like, well, why are we so sick? Because when you were children and you ate this food, you didn't get sick. We didn't get obese, and we didn't have all these inflammatory conditions, because your food is not what it is, right? It can't be cheaper than, when I was a kid, a piece of bacon or something that was added was more expensive. You had to pay $1 or $2 extra. And now it's like you're getting 3 patties with 6 pieces of bacon for $1, right? Even in my book, we'll cover the hot dog report. The hot dog report is something that everybody should be shocked about, because everybody's like, oh, I have ballpark, or this is kosher. One thing that you need to know, whether it's a animal product or even a veggie dog, because they all have to be processed in the same facility to make hot dogs, is that the studies show that across like 12 top major brands that you get at the health food store and at the supermarket, it contains 2% of human DNA. That's not a side little chili finger. That's actually an ingredient now. So you got to think of, like, for those who are older here, Soylent Green, and for those who are younger, Cloud Atlas, and that will give you some ideas. So what does this get us? 1 out of 4 people get sick, 328,000 people go to the hospital, 23,000 Americans die from eating food in America. I'm not talking about some third world, fourth world country. I'm talking about the United States here. 100% of store meat now contains, by USDA reports and consumer groups, 100% of that has bacteria in it. E. coli, salmonella. So that's why if you eat this stuff, you gotta make sure it's cooked. Okay. Some of it has cysts and parasites. Some of them have ammonia from the pink slime and the washing of that. If you don't know what that is, don't look that up before you go eat tonight. Meat now contains 2 to 5 antibiotic-resistant bacteria. So there's another doctor probably talking this week talking about superbugs and resistant things. This is a huge problem, people. Because people now, there are some people who've never taken antibiotics, they get sick, they go to the hospital, and now we give them all these things that doesn't work. It's because the food has been given the antibiotics over and over and over again. And remember, infections that are like E. coli and those things come from inside of the animal's gut. Vegetables do not have E. coli. They don't have listeria. They don't have salmonella. The contamination comes from a factory farm, or a CAFO as we call them, and that actually spills down the water stream. Right now, just couple of days ago, this administration, I'm going to get political, but they passed a bill to remove the Clean Water Act, right, which protects our rivers and our streams and our lakes. So now we can dump these things. And so if you're an organic farmer and you're growing your vegetables and this comes onto your property and you didn't take it to the market, people will get sick. All right, so let's now move to our diet. Where do you get your protein? We all know that. Plants. We need to have one question and one answer. So the main question that people should walk away today is like, is it pro-inflammatory or anti-inflammatory? Remember, you can get all your protein from plants, vegetable, grains, legume, right? But is it pro-inflammatory or anti-inflammatory? So if anybody has this argument or discussion or heated discussion, like, well, you need to eat this, I could just ask them and tell them, is it pro-inflammatory, anti-inflammatory, and just drop the mic and leave. That's all you need to know, right? So this is the main slide I want people to get today, right? Pro-inflammatory or anti-inflammatory. So animal protein is pro-inflammatory, plant protein is anti-inflammatory. Animal protein increases inflammation, it has cholesterol, little to no antioxidants, it has no phytonutrients, no fiber, and triggers heterocyclic amines, which are cancer-causing particles when you grill it. Okay? And plants are just the opposite. They lower inflammation, they have no cholesterol, yay. They're high in antioxidants, super high in phytonutrients, because they're plants. They have fiber, which you need, and there's no heterocyclic amines when you grill them. All right, so let me go into this in a little bit of detail. So inflammation real quick, we look at the pathway here. This is the arachidonic acid pathway. Arachidonic acid is what is triggered from eating higher amounts of animal protein. Also got to be careful of some of the refined vegetable oils. So too much French fries and fried food is not so good for you. Right? So the vegans who just eat French fries all day, they're still going to get inflammation as well. Right? So we want to cut down on eating too much excess oil. It's okay to eat the actual soy, the actual seeds, the actual nuts, but we want to lower some of the amounts of the refined products. But when people take ibuprofen, Motrin, Advil, those kind of drugs that are lowering their inflammation, and we're trying to lower these pathways here. But if you don't put it in your mouth, you don't need to take those products. Okay? Now, cholesterol. A lot of doctors will be here this week talking about cholesterol, so I won't spend too much time. Your body does produce cholesterol. We do need some. We can't have zero, but you don't want to have too much. Too much cholesterol that comes from the food, again, with the inflammation, causes cardiovascular disease. Remember, 3 people every minute will have a heart attack in the United States. 3 people. Okay? 3 jumbo jets of people die every day in America due to heart disease. There's no war on heart disease. Everybody's worried about terrorism. I'm not worried about terrorism. I'm worried about what my patients are going to eat at their next meal. Because that's what they're going to die from more likely than not. Okay, we can reverse heart disease. There'll be doctors here later on that will talk about reversing, so I won't get in there. But you can actually reverse heart disease clinically in clinical cardiology, even by angiogram. My book will cover examples of patients that we're being able to take off of the heart transplant list, just moving to a whole foods plant-based diet. And we can reverse all vessels, even documented on angiogram. Real quick, this is another slide that's in my book. You can see that everything that's in yellow is a plant, everything that's in white is an animal protein. You'll never be protein deficient. There's not a protein deficient diagnosis in America. Now there's empty calories, there's low phytonutrients and fiber and antioxidants in our diet, so we're nutrient deficient. But there's no deficiency in protein. What you'll see is that cholesterol only comes from animal proteins there in the white, and plants don't have them, and fiber only is found in plants' proteins. So when, I'll be frank, before I went plant-based, I'd finish my call at the hospital, I'd go to the local breakfast place, I'd have 2 eggs, 2 bacon, 2 sausage, 2 ham, and a piece of white toast with coffee with cream, standard Grand Slam, right? And if you look and you calculate, just 2 eggs have 423 milligrams of cholesterol. That's 7 times more than just a 4-ounce piece of steak. And so when you eat all these things combined, if I go to these breakfast places, I see people eat this and then take their Lipitor and take their diabetes medicine and their blood pressure medicine and then their laxative or their stool softener. So this is something that you have to really pay attention to. This is what we're eating. Phytonutrients and antioxidants. So antioxidants come from plants predominantly. Very little found in animal protein, particularly since 97% of animal protein is factory farmed. Right? So this is when people take multivitamins, it's because they're not getting it from the food. And also phytonutrients, phyto meaning plant, these are the most important phytonutrients because these are the things that help prevent, reverse, and treat disease. Now think of this like lycopene, beta-carotene, vitamin C, flavonoids, folate, indoles, allicins, anthocyanins, resveratrol, green tea, curcumin. All these things come from plants. In fact, all the products that you see out there are from foods that are coming from plants. There's no beef pill, there's no chicken pill, there's no pork pill, there's no egg pill that your doctor will ever prescribe to prevent, reverse, or treat a disease. But for some reason, everything thinks, I need to eat this, but they're like, well, why aren't we giving that to you to help your disease? We're telling you to restrict those things. And even the fish is the fatty acid of the fish oil. It's not even fish protein. And lastly, we want to talk about fiber. Fiber is important because fiber protects the gut. Fiber helps propel the stool. It helps feed your microbiome. 80% of your immune system's in your microbiome. So you want to feed that microbiome. And what it does is it removes toxins. Okay? So detoxification is just having 1 to 3 well-formed bowel movements a day. Don't do colonics, don't do coffee enemas, don't have to do some kind of green smoothie program. No, you just need to be eating a whole food plant-based diet. Now, why is that? Because fiber, then all the chemicals that we consume, good or bad, goes through the liver, it binds to fiber, fiber then helps it excrete the body. If you don't have about 40 grams a day, that's the goal that we're trying to get to in the United States. The average person eats 7 to 12 right now. So the tool is, and the word of advice is, you go up by 5 grams a week to whatever you are, wherever you are, to get to that 40 grams. Okay? If you can eat more, better, but just try to get to 40 grams. So if you're at 10, then go up by 5 grams a week. Eat another vegetable or fruit every day. I'll get you there over time. Don't just jump from here to here. People around you won't like you. So it's important because when we don't have that bowel movement, then it's called enterohepatic recirculation. It's like a recycling. So all these hormones, xenoestrogens, and toxins are going round and round. And from the colon, it just recycles into the body and goes around. So then we see this rise of inflammatory conditions like irritable bowel syndrome and colitis issues and colon polyps, and then the risk of colon cancer. Remember, colon cancer is number 2 in both men and women. So breast, number 1 in females, prostate, number 1 in men, and then both of you will get a risk of having colon cancer if you eat the standard American diet. Now, recently I was at a conference last year, and they were showing data from Africa where in rural Africa, which they eat very little processed food, there's lack of access, they eat tons of fiber because all the food is just like whole foods, okay? And the amount of fiber is actually higher than what we were even trying to get as a guideline, like 60 grams or higher. Wow, that's really, really crazy, but they do that because that's the food that they eat. There's virtually no colon cancer in that part of Africa. Less than 1 person in 100,000 has colon cancer. They don't even know how to diagnose it because it's so rare. In fact, they have a higher chance of getting eaten by a lion than getting colon cancer. And yet here in America, it's number 2 cause of cancer death in America. Right? So when people say, we have to think of fiber, fiber is super important. Fiber only comes from plants. It doesn't come from mothers or faces. Saturated fats, you want to avoid saturated fats from animal products. You want to have a little bit of healthy fats, but not too much, especially in the oil form because that's still a highly refined product. So less oils, but eat them from the food, like the seeds and nuts and some of the avocados. Again, you want to be eating complex carbohydrates, not simple carbohydrates. Now, everybody thinks carbs are bad, but it's the type of carbohydrate that you're eating. And we should be eating the complex. If anybody says anything that you shouldn't be eating beans or legumes or lectins, they need to go back to school. Simple as that, right? Some of these people, I think, are doing a great disservice and creating a lot of harm. And eventually they'll probably be pulled off the market or held liable for that bad information. This is what your plate should be like. Physicians Committee for Responsible Medicine always puts this out. So it's a little bit of fruits, grains, legumes, and vegetables, and water, predominantly, avoiding the dairy and avoiding the soda. So when you see a picture like this, and someone comes up to you and says, well, where do you get your protein? I say, well, where do you get your anti-inflammatory protein? Where do you get your phytonutrients? Where do you get your antioxidants? And where do you get your fiber? And then I drop my mic and then I go. Okay? Now, food testing. So what we like to do is when people go plant-based, there's a tendency that people can go plant-based and then their symptoms get worse. I was doing, I'm smoothing, I'm having salads, I'm eating all these sprouts, I'm eating foods and avocados, and all of a sudden my joints got worse. I got diarrhea, I got gas and bloating. It's not just the fiber increase. Now we're looking at as food sensitivities. We want to look at now taking an individual and saying, here's your level of data. The data shows that we should be eating plant-based. No more end of discussion, end of argument. The science is there, that's what it proves. However, we need to look at each individual. Do you have a sensitivity? There's 2 types of sensitivities. One that you can eat a food within an hour have a reaction. Mine was very serious. My peanut reaction was very serious. That's within a few seconds. 2% of the population have that anaphylaxis. 98% of the people can have an immediate reaction that's not life-threatening. So you can eat something and just have heartburn, reflux, diarrhea, constipation, headache, back pain, whatever it is. It's just not life-threatening. Okay? That's one type of reaction. The second type of reaction happens a few hours up to 4 days later after consuming it. So today is Saturday. Okay? So Saturday, so somebody can have something on Thursday and today have a flare of whatever their itis is, or Friday. So these are things that stack, and eventually you tip the point of function and dysfunction point. I explain this in detail, but this is key because we want to then look at, people can have a sensitivity to kale, or blueberries, or some of these wonderful things that we consider a superfood, or here's a super supplement, but if you take it, you can actually get worse. So we like to then individualize and then specialize what is the most anti-inflammatory diet for you. We look at nutrient testing. So it's not saying eat more foods that have this. It's actually looking at what are you absorbing. You know, people take supplements all the time. People eat a whole food, plant-based diet. I got people like, oh, I do all these smoothies. Fine. Well, let's test it. Put it to the test, as Dr. Griegel will say. It's like, is your levels up to par? So when we measure that, because here's the thing, supplements supplement the diet, they don't replace the diet. And everybody wants to replace the diet with supplements. I use supplements all the time, but it's targeted. So if there's a deficiency, the nice thing about the testing that we do is it will tell us how much you need, and more importantly, what foods they're heavily found in. So you can eat a lot more of those things, and you get all the rounded of all the benefits of getting for food. If there's a true deficiency and it's hard to eat, then that's when supplementation can be a game changer. We look at the patient's microbiome. We want to look at, how is your digestive function? How is your digestive enzymes? Are you breaking? Because some people have really, really low digestive enzymes. So how can they eat a raw diet? Like, I can't do it. Right? It's just I get so much gas and bloating. I can't break down the food. We want to look at, are you eating enough protein? Are you eating enough fats? Are you absorbing it? Is there inflammation in the bowel? Do you have small intestinal bacterial overgrowth, SIBO, or candida overgrowth, or yeast overgrowth, or parasites? But the idea is when we test for this individually, it's not just treating patients on symptoms, because most people will go to a GI doctor, oh, you have SIBO, here's an antibiotic, costs $2,500, and they'll blow out your gut. But it's safe. And then you'll have natural therapists who will say, oh, it sounds like you have candida, or a parasite, here's a parasite product. But what people don't realize is that all these products not only knock out the bad guys, they also knock out the good guys. And antimicrobial is antimicrobial. Whether it's garlic, whether it's oregano, whether it's berberine, whether it's golden seal, these all have antimicrobial effects of doing good things, but they also knock out the good guys. So when people say, oh, I take this product to prevent it, you shouldn't be taking any kind of product for antimicrobial for prevention. That's a treatment option. Right? So a lot of people are like, I wouldn't take amoxicillin for forever, so why would you take that product forever? Because they don't understand plant and herbal medicine. So this is a disconnect where people now can cause treat something initially, safely and naturally, and then actually spin them out into dysfunction, and just like as if someone was taking too much antibiotics. So we also will check about leaky gut, and this will be explained in my book. So anybody that has IBS, or anybody has heartburn, reflux, diarrhea, constipation, the book will go into detail. Anybody who's taking the purple pill or any of those kind of things, it will be heavily discussed. Eat a whole food plant-based diet, and start off with just getting tested, and we can help people like that. But we want to start with eating 3 additional fruits and vegetables a day. That's 30% risk reduction. 6 is 60, 9 is 9. That's why the USDA will say eat 9 servings a day, right? If you need to put it in a smoothie, if you need to eat it in a bowl, it's fine by me. You need to get it into the body as much as you can. I'm not a purist. I'm a realist. So realistically, any movement in the right direction is a good move to begin with. Now, switching the subject. Okay, now, ta-da! Blackbox warning. Okay, so this is my soapbox. I thought of all this other stuff. It's like, okay, if you don't understand eating plants now, you should. By the end of the conference, everybody's going to be growing a garden on some level. So, good. Blackbox warning. What's a blackbox warning? Okay, so this is something that everybody should know. And this is what I've become well known to talk about because we're looking at the black box warning. Every drug that you get on the market, it may have a black box warning or it may not. What a black box warning is the following. When you look at the monograph of a drug, any drug that you take, whether it's over-the-counter or by prescription, it will have something what they call common side effects and serious side effects, okay? So common side effects, for example, taking ibuprofen or Motrin or Advil is just like diarrhea, constipation, heartburn, reflux, ringing in the ears, swelling of the ankles, okay? Maybe rash, okay? Not life-threatening, won't die from it, but maybe not so comforting, right? Then there's serious reactions, and serious reactions mean something that can cause a heart attack or a stroke or a GI bleed, okay, or some cancer of some kind. Those are rare. So rare things occur rarely, common things occur commonly. However, if a product has a problem that's serious, that then starts to occur commonly, then the FDA puts out what they call a black box warning, which means you can end up in the black box. Okay? Now, I like this cartoon. It says FDA-approved drug, and it says warning contains FDA-approved drug, because that's really what it's at. What happens is this. Once you get that little package or bottle and you tear open that package, so right now if I went to the gift shop right here, say, oh, my back hurts, my feet are killing me, let me take an ibuprofen or let me take any kind of non-steroidal anti-inflammatory right now. If I tear open that package or I open the bottle, I've already accepted the terms and conditions that this can happen. The black box can happen, and there's no legal recourse that you can take against the manufacturer. So when we think of NSAIDs, non-steroidal anti-inflammatories, this is what 1/3 of Americans take daily, 30 different types of prescriptions, right? So it's not just, ibuprofen is Motrin and Advil. Those are brand names. But you can go to get Walprofen, Civis. There's tons of generics of those, right? And we think of naproxen as Aleve, and we think of celecoxib as Celebrex. But these all have black box warnings, right? So one of the things that people have to understand is that when we look at the data, lifestyle, heart disease is number one in killing people. I mentioned that earlier. Cancer, stroke. But when we actually look at other data saying what is still killing Americans even more than heart disease, that's not lifestyle, it's not terrorism, it's not anything else that we should worry about. It's actually medical errors and side effects. Kill more people than heart disease, than cancer, and stroke combined. So my book will cover this data because this is something, when people say, oh, well, people die of heart disease. Yeah, but people are now dying more of drug interactions, side effects, and medical errors in our system than actually the diseases that we're trying to treat with those medications. Now, all the NSAIDs have black box warnings, so you can have a heart attack, a stroke, or a GI bleed at any time taking just one of them. So we used to think, oh my God, you have to take tons of ibuprofen or tons of Aleve to have a heart attack or stroke or a GI bleed. No, you can say, I just have, have menstrual cramps once a month. I just take this for my period pain. Or I have back pain or my feet today. I'm going into a lecture just once a month, okay, so I'm going to take one of these things. I can take that and I can have a heart attack even if I eat plant-based and my vessels are clear. If you have any comorbid conditions like obesity, diabetes, heart disease, blood pressure problems, your risk is higher. If you have any problems like, I take an acid blocker or a purple pill or have IBS, your risk for a GI bleed or intestinal perforation is higher, right? But we don't count these in the data because this is not the cause of death. We will say, oh, well, they were under stress or they already had heart disease. So this is contributing to why we're having more people have these things. So what we want to look at is there something natural that we can give that's anti-inflammatory, that's safe, natural, clinically effective, and yes. And so this drove me not only to research what is causing our inflammation from the food in our diet, but it's also what can we give that's not a non-steroidal anti-inflammatory, because in my opinion, it's not correct for a lifestyle physician or a plant-based doctor to be like, okay, let's eat more plants, and then, oh, you have a pain problem, take ibuprofen. That to me is just as a disconnect. Because food is medicine, and there's plant medicines that come from plants that we should be using instead of just using pharmaceuticals that might have side effects, okay? I'm not anti-drug, by the way. I'm not anti-pharma. I'm just pro-patient, pro-safety, pro-data. And if the data shows that something is not as good as they proclaim it or market to, then I will look at what is safer, what is more efficacious, and what's more affordable. So this is a product that I've used, and I don't want to be too much promotion, but I want to talk about this in general. I want to talk about the difference real quick between patents and natural products, okay, and generic extracts. So when I talked about ibuprofen before, ibuprofen is a synthetic molecule, so there's a brand name of Motrin and Advil, right? And then you can go get a CVS Profen or a Walprofen, for example, right? So generic ingredients, when it comes to pharmaceuticals, are okay because that molecule is the same. It's just which brand name and packaging and marketing you want to go with. So when we buy pharmaceutical drugs that are generic, we like that. It's cheaper. Right? We want to save some money. Why not? It's the same molecule, same product. Okay? But when we look at natural products, we cannot patent a natural product because you can grow it. You can grow turmeric, you can grow wheatgrass and blueberries and tomatoes, for example. So you can grow those things. But what we can patent is, though, how we extract certain compounds at certain ratios with certain technologies, then that can be standardized so that that potency and purity is there every time we do that. But once it's patented, no one else can do that. So with curcumin, I'll give you an example, which is the first example, the first ingredient. Everybody knows of curcumin. Curcumin is 2 to 5% of turmeric. So there are two different things. Turmeric is the whole plant, the whole root, and curcumin is what's extracted. But a lot of people tend to think, hey, these are the 3 curcuminoids that was extracted at a specific ratio. We use C3 complex. That's the gold standard, over 70 studies that are done now at universities and medical centers, more than any of the other products in the market combined, all maybe 50 of them. What it does is this. When we look at generic ingredients, they now have studies where, since they can't take and extract it, everybody says, well, my product has 95% curcuminoids. Isn't it the same thing? No, it's not. We actually have studies in vitro and in vivo comparing the top 4 manufacturers. This is all independently done, by the way, at research universities, that they look at the top 4 manufacturers that make the base supply in the United States of 95% curcuminoids and has very little anti-inflammatory effects and very little immunological effects compared to the gold standard. Right? But no one's here talking about efficacy. They're saying, well, I'm giving this, but everybody's taken. I can probably say most, but 80% of people here in this room has taken some kind of turmeric or curcumin product. And I'm going to have to say with conviction, you haven't taken the right one. And that's why people are like, oh, I tried that. I've done that. It's like, well, if it worked, you would still be taking it, right? So we have to look at, why is there a disconnect? So sometimes we have to look at, in the studies, is it something that actually is there in the study to show that it actually has safety, efficacy, potency, purity? A lot of questions that I get is like, well, Dr. Pai, some people say that I have a new curcumin. It's like 25, 65, 125 times more absorbable. And we see this marketing all in the health stores too. And so when we look at the data and say, well, what are they measuring as a metabolite called glucuronide? And that glucuronide has no anti-inflammatory effects. So 125% of something that doesn't do nothing is just 125% of something that does nothing. But what it does allow them is to have a higher profit margin and sell you a product that they think is better, faster, quicker. But the data won't show that. And clinically, we won't see that. Okay? The other thing is you have to look at safety. So when we look at now curcumin, you can see actually with turmeric and curcumin, the last 3 months you saw a lot of reports of lead toxicity, right? People actually were going to the emergency room taking high doses of turmeric products on the market, and it had containing lead. Because the machines in China that people use, the grinders that take out the skin, actually is where the lead particles were coming from, right? So we have to be careful. The largest manufacturer, one of the largest suppliers of generic turmeric product from India, actually there was a lawsuit that we were part of looking at the investigative data on that, is that 43% of that is now synthetic. Okay, so we can make synthetic curcumin. So right now, if I go on the internet, I can get a curcumin, a boswellia, ginger, a similar product for $3 packaged and delivered on the internet, right? If it's $17.99 a pound coming organically from the ground, how can you get this product for $3? Right? Do the math. It doesn't work. So these are the adulterated products. But again, there's no regulation because these are dietary supplements. Same thing when we go to boswellia. Boswellia is frankincense, right? We're looking at the AKBBA, the polysol, which is a new fraction of it, and the boswellic acids. When we look at herbal formulation and herbal medicine, sometimes in pharmacology, I used to think, a long time ago, before I became more versed in understanding herbal medicine, is that when we found something, let's just turn it up to 10. Let's just crank it up. That's the ingredient, let's crank it up. That nature doesn't work that way. When we do studies, actually, we're able to see that sometimes when we put too much of one thing, it doesn't have any more benefit. And sometimes it's actually not a benefit at all. So we have to do studies to look at what's the combination of the ratios of when we get. So again, more is not always better. Boswellia is frankincense, for those who don't know that. Ginger. So ginger is a food that we all should be eating. That should definitely be organic. Again, anything that's a root crop is sprayed should be organic. So if you're getting a ginger extract or ginger powder in a supplement, just eat the ginger. If it doesn't have gingerols, which is that important part that's extracted, then eat the food. I tell people just chop some ginger, throw it in a smoothie, or cook more Indian food, Thai food, and use ginger as a spice that you should be using every day. But when we're looking at the strong anti-inflammatory effects as a medicine, we have to be looking at gingerols. We have the highest amount of gingerols worldwide, 20%. Bioperine is the black pepper extract that's been patented. 95% piperine. So same thing as the curcuminoids. A lot of people say, well, I just have black pepper in my product. It's helpful, but it's not as effective because it's how we extract those piperine compounds. Now, I'm not saying that eating the whole foods of these things are a problem, because we should be eating them in our diet. But when we give it as a nutraceutical to actually look at, now, I need to intervene in someone that has a condition, there's a different level because we're now making it a nutraceutical. Okay? Now, there's a concept of synergy. So a lot of people would take, say, curcumin, and say, oh, I used to take tons and tons and tons of curcumin, even if it's the right one. But now we're understanding is like, how can we look at synergy? Synergy is when people understand Ayurvedic medicine and Chinese medicine and Western herbalism, we understand how to balance certain ratios of ingredients so that you prevent tolerance of the product. Sometimes you might take a product and it works for a while, and then it doesn't work. Sometimes you take it a while and then too much, you get a side effect. So when we actually look at formulation, synergy is a key part. And even more so, what took us a long time, and we're the only company that is able to do this, is that we have a bilayered technology. What that means is that there's a water-soluble fraction and a lipid-soluble fraction. What does that mean? When you take the product within 20 minutes, like a fast tab. Remember, everybody's used to like, oh, I need to get my Tylenol fast tab, my ibuprofen fast tab, my Aleve fast tab. It's like, I need to get that. I have a headache. I need to get instant right now. So within 20 minutes onset of action, it is absorbed into the system. And then a sustained release, SR, sustained release, for 8 hours. Okay? Eventually, we'll have the technology that we can get to 12, right? We're happy to get 8. So the concept is that we can take something now, why else do we bilayer it? So this is something that most people in manufacturing industry and even in the herbal products industry don't know. When you put ginger, turmeric, boswellia, or black pepper, or you put bromelain or papain or even nattokinase or any kind of proteolytic enzyme in a capsule, those enzymes will degrade the other ingredients in the capsule while it sits in the capsule. Right? So what happens is something is made here in New York, takes about 3 months by the time they manufacture, put the label, put the packaging, and gets out of the warehouse, gets sent to distribution, and goes all the way to California. California gets the distribution and sends it in a truck all the way to New Mexico. By the time I get it, it's like 9 months later. That product's potency has decreased as it sits on the shelf, even if it's kept at the right temperature. Right? So we ensure, because we're trying to make food as medicine, and then make our plant medicines more medicinal, is looking at how do we ensure that 100% of what you get is there at the time that you take it. And this is what we do, by bilayering, sustain releasing it. Now I want to switch to immune system functioning. Everybody needs to strengthen your immune system. I have a whole chapter in my book on how to strengthen that. We talked a little bit yesterday about vitamin D in the panel. So everybody should get their vitamin D level. It's simple, it's effective, it's cheap. Right? So vitamin D, should take it. You should have your body, your primary care or health physician check it, because that's something that's very effective. 60% reduction when you get between the level of 50 and 100 on the test. Okay? Cancer patients or people with chronic issues, about 70 was the targeted data that show. That's an indirect marker showing you how strong your immune system is functioning. Right? So any condition A through Z, whether it's a mood disorder or colitis or any kind of inflammatory disorder, that condition will get better when the vitamin D is up. Because the body will tell us the vitamin D is a marker to say, is the troops up? Is your military, your Army, Navy, Air Force, Marines doing their job? It won't tell us which one. It just says, again, like I mentioned yesterday, did the Pentagon get $762 billion of our taxpayer money? Yes. Hopefully they spend it correctly, right? So we need to still give funding. So the body's like, it still needs to have that to help the overall immune system. But then what do we do to get further benefit? So a lot of plant people we'll see is mushrooms, right? Mushrooms are important. Furman talks about mushrooms. A lot of people will talk about mushroom blends. Chinese medicine, Japanese medicine, we all use mushrooms. Mushrooms have an important compound called beta-glucans. Okay? All mushrooms have it. Right? So you should be eating as much mushrooms as you can. Good protein, good fiber, and more importantly, it's good for your immune system. Now, the thing is, when we use it in products, the beta-glucan that can be extracted, whether it's ethanol or even alcohol or even water extraction, is about 20%. So the max that the average product that you get on the market only has 20% polysaccharides. And what we've looked at is there ways that a company in science can actually make this beta-glucan stronger? And what we've been able to do is there's something called Glucan 300. It's not my product. It's just something that I use directly from the source of the patent, is that it's been shown now to have a minimum of 83% 1,3-beta-glucan. So what that means is that the potency is a lot higher. It's actually grown on a culture like a probiotic, right? So we don't have to worry about getting so much fields of mushrooms to try to extract this little amount. So the cost goes down and the potency and the purity goes up. Now, more importantly, independent researchers at universities have done studies in vitro and in vivo. So when we look at mushroom extracts, there's about 60 different mushroom extracts on the market. And they're all good. They all have studies that it works better than nothing. However, when we put it to the test, which one is better comparatively in the cell culture and in the animal model? Which one lowers inflammation? Which one stimulates your natural killer cells the best? The Glucan 300 has done the best. So what I look at is when I tell patients to take a product, I'm like, take this product for a specific thing. Eat as much mushrooms as you want. But I don't want redundancy where people are like, oh, I'm taking this mushroom extract and this mushroom extract and this mushroom extract from my immune system. Now, certain mushroom extracts are good for your brain. Some of them are good for adaptogens. So they have other benefits of other components, which is what we would like to use. But when they're looking at just for the immune system by itself, then I like to use one thing so that it's not redundant and eat the food to get the rest of what we consider the entourage effect. Okay? So 160 times more than AHCC. You can see 32 times more than Epicor, 16 times more than Wellmune, 8 times better than Maitake, and even PS Creston. It's a $700 drug by prescription in Japan. Right? So we can get something that's very inexpensive that actually has data to show that it does what it does. Everybody else may give just a little bit, but we have to move further than that. So along with the 10 steps, these are the 10 steps, I want to just finally end up with a few things. Sugar and salt. That's another part of the book. So sugar and salt. And again, I have all these steps, so you can see there, healthy glucose. And I'll go into the history. So even with sugar, it's not just that sugar is bad. If you understood the history of how sugar was even brought to this country, you'll be surprised. I'll leave that up to you to read. But sugar is pro-inflammatory, right? We eat too much of it. Most of it's GMO. Most of it's high fructose corn syrup. And so this is a pro-inflammatory state. So when people have diabetes, they have 4 times the risk of heart disease. Now we call it type 3 diabetes, where when people have this high or even mildly lower elevated blood sugar, that this causes a chronic inflammation in the brain. So when we talked about Alzheimer's and dementias and Parkinson's disease, this is just this chronic inflammatory state that most people are walking around in. So we're eating way too much sugar. I'll cover all that. There's wonderful studies in my book showing that there's been schools and prisons that have removed sugar from the, like they did control studies where they remove the sugar from the diet in the school, and the kids' grades and their behavioral scores go up. Okay, prisons, when they remove the sugar from the diet in the prison, then less fights and more, there's more cooperation between the inmates, right? So this is something that, we actually have thousands of studies now that we're looking at the role of sugar, and obviously we're looking at even children, sugar causing inflammation in the brain, causing behavioral problems. Salt is another problem. Salt, people take too much salt. Now, we like natural salts. I like to use more of what we consider the Himalayan salts, the salts that are mined. But you have to be careful of the mined salts because it has to actually say that it's sourced from the Himalayas. There's a lot of what they call pink salt out there that will not be sourced from the Himalayas. It's just salt with pink color. And people will think it's coming from that. So you have to be careful of that. Remember, everything is being adulterated. In sea salt, I don't recommend sea salt. Sea salt has microplastics in it. Sea salt also is just whatever the sea is coming in, that's just dried up. So where you're getting sea salt, whether it's coming from Louisiana or coming from the salt flats or some other place, you have to look at what's the source of the environment. And right now, there's too many things in the ocean that's causing pollution for the sea salt to be recommended. Meditation and yoga. If I could put this in a pill, I would. And I would be the richest man in the world. I can't state how important meditation and yoga is. My book will cover the data. Because a lot of people think, oh, it's meditation, oh, it's just yoga. No, if it's done correctly and properly, and we have all sorts of wonderful controlled studies looking at how we can improve your immune system, how we can lower your blood pressure, lower your cholesterol, lower your, even improve bone density with yoga. Okay? But I'm not talking about hot yoga, I'm not talking about Mick yoga, I'm not talking about beer yoga or goat yoga. These are all just trends that people will try to take something that's actually a true art. It's a true science. And in India, we have masters and PhDs of yoga. People go through years in school and training. We have protocols in our clinic where we can reverse heart disease, diabetes, we can help with mood disorders. And they just do that with yoga. So that's another level. We use herbs because that's kind of what we think. I'm more of a doctor in my thinking, so I like to give things. Right, prescribe herbs, prescribe diets, and all. But there's another level of mind-body medicine where you don't even need the supplements. You don't even need the herbs. Certain types of pranayama, breathing techniques, certain meditation techniques, certain asanas can actually reverse the disease. And they have clinics in India where they actually have run by MD doctors, and we take patients in, and they do all these therapies, and I was shocked. I'm like, you don't give even herbs? You don't need to. So there's levels of health that you can get, and so if you're tired of saying, well, I'm tired of even taking supplements, then you can go even further, okay? So meditation and yoga are very, very important. Lastly, I want to talk about this, love, happiness. John Lennon said all you need is love. It's really important. We do need love. Not only loving each other, but we have to love ourselves, right? And a lot of times right now, people who are having a lot of animosity and hatred to other people is because they actually don't love themselves. And so we have to look at when people have what they call coexistence, or we call tribe, they live longer. All the studies will show people that have cancer, for example, right? If they just, like I mentioned yesterday, if women who have breast cancer have group and they just meet once a week or once every 2 weeks and they just talk and share amongst themselves, they live 15 years longer. 15 years. If we have a drug that keeps someone alive in the ICU for 30 days, it's considered a blockbuster and will make anywhere from $8 to $15 billion on the market. And here's 15 years longer, right? We need to live with a sense of purpose. Again, the studies will show that if you have purpose, even someone with a cancer patient, anybody with chronic disease, it's not saying, I'm going to kill my cancer, I'm going to fight my cancer. It's, I'm living with purpose. If you live with purpose, those patients live longer because the focus is on doing what they're doing. Oh, I like to grow this, I like to help my people. Sharing and serving others, as simple as that sounds, is so profound, right? So when we see patients in our clinic, we see a lot of cancer patients. Okay, that's because cancer is now 1 in 2 men and 1 in 3 women in the United States, unfortunately, through standard American diet, lifestyle, environment. But when we look at these aspects, we like to take a cancer survivor and turn them into a cancer thriver. Right? As Americans, we all can survive, right? You're New Yorkers, you survive a lot of things. You have 9/11, you can have a hurricane, you can have power outages, you can have gun shootings. Americans, we're good. We can survive. But we need to do better than surviving. right? Because, again, anybody can survive, but are we thriving? Thriving means that you're doing better than what you were before you had your diagnosis. Our goal is through the epigenetics that we teach and the 10 steps in my book, we can help resolve and fix those things. And community is a very important thing. So if you don't have community, hopefully here you meet someone, hopefully you get connected with someone that maybe will share this journey of going on a plant-based diet or eating better or going to more of these conferences, support communities like this, because this is important, because believe it or not, there's a value in this. And as collectively we coexist, then this is how we shape policy. This is how we shape buying patterns, right? By eating more organic, then hopefully some of the stores may carry more organic products. By eating some of these, let's say, I don't want to have this because this has herbicides or pesticides. That changes buying patterns. Every time you buy something, you're voting. Right? So hopefully through community, through coexisting, we can do this. Now, in my book, I do have a lot of quotes. I play drums, I play guitar. I'm known as the rock doc. We see a lot of celebrities, we see a lot of athletes, we see a lot of musicians. We help them with their lifestyle as well. And so I like to end with this, because it's a quote that I want people to think about, and it's from actually a band that's a little bit politically active right now. It's called Rage Against the Machine. And the quote goes, it has to start somewhere, it has to start sometime. What better place than here, and what better time than now? Thank you.